Welcome back after this short break. As we know, we are doing a discussion with Oscar Fernandes ji, and Madam is also present with us in our program. Welcome back once again. Well, sir, as I was saying that the Parliamentary Forum is doing a lot of sensitization program, which may be basically informative, educative, and communicative. So, how is the Parliamentary Forum putting all the legislators, parliamentarians, and as well creating awareness in different states of India, or especially Northeast?
We are working in close association with the Ministry of Health, NACO, which is basically cut out only for this purpose. The Secretary Health, who is in charge of NACO, was present. He gave a vivid picture of the whole scenario in the Northeast, the number of cases, and what specially we are doing for the affected people. It's not merely a case of dealing with awareness. We are also dealing with people affected. When the question was raised by the affected people that you are talking of awareness, but what about we people who are affected already? How are you going to help us? We took up the matter with the government 10 years ago, and the government today is providing free treatment for all affected people who need this treatment. This is one of the outcomes of the efforts put in by the forum, taken up with the government of India, and the government of India has been able to. Now, in all over the centers in the country, any affected person goes, he is able to get treatment. This is a main benefit out of our forming this forum. The donor minister, Paban Singh Tawar, was there. He said, I am willing to take up with my ministry, call the officials of the health ministry, sit together and see that if any infrastructural requirements are there, like hospitals, like any care home or facilities are required for the northeastern people, I am willing to examine this. This is a very good result of the efforts they have put in. We are coming out with a declaration also, with a commitment. If you see the Nagaland brochure, Nagaland says that will stop infection by the rate 2015 will stop spread of HIV AIDS in Nagaland. It's a very determined effort on their part, and I wish all the states of Northeast will take that challenge, that in another 3 years or 5 years we are able to stop the spread of HIV and AIDS. From the UN, the representative was there. The representative said that we should stop total infections. We should stop anybody dying out of HIV and AIDS. This is the kind of awareness we are going to create in the Northeast, especially the youth. You may say it is unprotected sex, but today children, youth are aware how to protect themselves from these evils, and they are also taking precautions so that the infection doesn't spread from person to person.
So there may be cases where in remote areas where blood transfusion or the use of syringe, sometimes they are saying that they are not being able to use the disposable syringe. So in such a scenario where we have the cases may be very, very less, how are we trying to reach to the
there also we are creating awareness. In Britain, in Europe, it started that they were distributing syringes free of cost to the people who are used to drugs. They are given. So similarly, that practice also has been developed, and awareness is created that you don't use the same syringe which has been used by others. Our effort is to see that people do not go to these drugs at all. They keep away from the drugs. But we cannot ensure that 100% people are kept out of this. But a major setback in the Northeast is that not only Northeast, many parts of the country, all deliveries do not take place in the institutions, that is in the hospital. I had been to a particular state 5 years ago. When I checked up, they said the institutional delivery rate is only 12%. That means even if a pregnant woman who is infected with HIV and AIDS, we will not be able to detect whether she has HIV and AIDS or not unless she is tested. So testing facility is required. Testing facility is available only in many places in the district headquarters and not in the primary or tertiary level health care centers. So, if a pregnant woman knows that she is infected with HIV, then only she can take a medicine to prevent the spread from mother to child. But if she is not aware, if the hospital is not aware, the testing facility is not there in the hospital, how do you make out that the pregnant woman is carrying the infection? So, these things are required. That is why I said, when I talked to the donor minister, he said, I am willing to provide the infrastructure. It is for the states to come forward, the health ministers to discuss this subject and see that wherever the infection rates are higher, in such places to take it right up to the primary level, the testing facility. And if a mother is found to be having this, testing should be done and treatment is given then and there.
So, we understand that treatment for HIV AIDS is a very difficult possession, or it is a very costly affair. So, earlier part of the program have been saying that a discussion will be made to find out a drug for this disease. So, if you can just throw light on this.
No, the point is the best way to do it is to have vaccine. So far nowhere in the world we have been able to get a successful vaccine which can prevent the spread of this or getting individual person infected with this. The second option is to get the treatment. Now, the silver lining for India is that the Indian drug is the cheapest in the world. Out of about 180 countries in the world are buying the treatment from India. And to quote Clinton, former president of US, he had said, if you buy treatment for HIV and AIDS from a multinational company, if it can cater to one single person, for the same cost, if you buy the Indian same treatment, you buy from India, you can treat 10 people. That means the Indian drug is much cheaper compared to the drug available in the international market. That is why all the African countries, the other developing countries, European countries, they are buying drugs from India, and I should compliment the Indian pharmaceuticals for this great achievement they have achieved.
So, Nagaland has said, like, adopted a resolution saying that by 2015 there will be no AIDS in Nagaland. Infection in Nagaland. So, are the parliamentary forum willing to accept such an idea for entire nation so that we can completely eradicate?
No, that is our idea. The very fact that we are having interaction with people is, if there are places where they have taken determined action and planned program to prevent this, it should show us a path to reach to that goal where nobody gets infected. We will first try to implement this in the Northeast so that we are free from this disease in the Northeast. We will carry the same message to the rest of the country and see that there is zero level of spread of HIV.
So, do we have a model of sensitizing the people, because we know that information awareness means television, newspaper, print ads, or maybe some kind of road shows or concerts which are specially held in some states of Northeast. So, will this model be continued?
We do that. That is very essential. Your musical nights, musical concerts, they are very effective. Even sports meets where they can talk about this, attract the youth, discuss this issue. It is very essential that we have these shows in the Northeast. Even television, pictures, news, this is all going to help the students in getting the message.
So, finally, like, we are coming to the end of this program, what will be your message especially to the Northeast so that they can keep themselves away from getting the infection?
Yeah, that's one is, there shall be no spread from mother to child, for which we need to take every pregnant woman to the hospital, get her tested, and if found positive, give her immediate treatment so that it does not spread to the born child. The second part, infection from person to person. As I mentioned, the Nagaland message, it should be a message for all the states of Northeast. They should take all precautionary measures so that it will not spread from one person to another, whether it is the sexual route or whether it is the drug route. They should take precautions. And treatment, every individual who is affected should get treatment, so that because of this particular infection, nobody should die.
Thank you so much, sir, for talking to us and enlightening our viewers about the infection of HIV and AIDS and what is the government doing to eradicate this menace and the stigma which is attached to this disease. Thank you so much, ma'am. Thank you so much, sir, for being part of this program.